Hello everyone and welcome back. Okay, so now moving towards the next disease, that is gynecomastia. So what is shown in the picture? This is gynecomastia. What are the causes and how will you investigate? What is pseudogynecomastia and how will you manage? So this is a male patient with gynecomastia. This is the diagnosis, and the causes are idiopathic, physiological in neonates and adolescents and in old age. Drugs, for example, spironolactone, digoxin and cimetidine can cause gynecomastia. Hypogonadism, for example, Klinefelter syndrome and Kallman's syndrome and testicular feminization syndrome, these can cause gynecomastia. Then CLD, that is chronic liver disease, and estrogen and HCGs create secreting tumors can cause gynecomastia. Hypopituitarism and hypoprolactinemia can cause gynecomastia. Now the investigation options are serum testosterone, follicle stimulating hormone, luteinizing hormone, estradiol, HCG and prolactin. LFTs are done, history of the drugs is taken, and chromosomal analysis is done. Now, what is pseudogynecomastia? So, it is the enlargement of male breast tissues due to fat deposition with no increase in glandular tissue, for example, in obesity. These are the pseudogynecomastia. The management options are counseling and reassurance and correct the underlying cause. Then anti-estrogens are given, aromatase inhibitors are given, and surgical excision is done. Okay, now the next one is herpes labialis. These are herpes labialis. So what are the causative organisms and what are the complications of these diseases and how will you treat patients? So this is herpes labialis and the causative organism is herpes simplex type 1. Okay. Herpes simplex virus. The complications are disseminated infections, eczema and herpeticum, encephalitis and meningitis, herpetic whitelow and keratitis. These are the complications. The treatment options for herpes labialis are local acyclovir cream and tablet acyclovir and foscarnet adoxyridine. Now this is xanthelasma. This picture shows xanthelasma. These are the growth of the substances for the eyes. So what is the abnormality? What are the different physical signs of lipid disorders? How will you investigate and how will you manage? So it is xanthelasma, and the different physical signs are corneal ulcers, tendon and tuberous xanthomata, palmar xanthomata and lipema retinalis. Okay, these are corneal ulcers and retinalis and palmar xanthomata. The investigation options that are done in case of xanthelasma are lipid profile is checked and RBS is checked, then T3, T4 and TSH is checked and ECG is done. The management options are that xanthelasma by themselves need no treatment. If laboratory values are abnormal, then general are dietary modifications, avoid alcohol, smoking, exercise and reduce weight, treatment of diabetes and hypertension. Okay, xanthelasma is a lipid disorder and it occurs due to diabetes and hypertension. So the treatment involves this dietary modification, the avoid alcohol and smoking, exercise and reduce weight, treatment of diabetes and hypertension. Now lipid-lowering drugs are HMG, coenzyme A reductase inhibitors and statins, and fibric acid derivatives and fibrates, and cholesterol-binding resins and nicotinic acid and derivatives. These are the lipid-lowering drugs. So these are used in case of xanthelasma. This is myasthenia gravis. We have discussed the case already. The investigations are tensaline test and serum acetylcholine receptor antibodies, nerve stimulation studies, chest X-ray and CT or MRI, and ANA rheumatoid factor. ESI is also done. Now the treatment options are oral acetylcholinesterase, for example, pyridostigmine is given. Thymectomy is done. Immunosuppressant, for example, steroids and azathioprine and cyclosporine is given. Plasmapheresis is done and intravenous immunoglobulins are given. Antibody directed against acetylcholine receptors. Okay, this is exophthalmos. We have discussed this case already. This is koilonychia. Koilonychia is the nail spooning of the nails, and it is due to iron deficiency. This is ptosis, and this is also known as third null palsy. There will be the palsy of this left side of the ptosis is the palsy of the eyes. This is acanthosis nigricans, that is hyperpigmentation of the underarms or back of the neck or any other area in the body, and this is usually due to this occur in the patients of diabetes mellitus usually. This is SLE, this is the butterfly rash, and we have discussed it, right? What are the changes in the picture. So this is the rash, what is the diagnosis, it is SLE, and what screening test you will perform. So these are the an antibody, antiphospholipid antibody, double-stranded DNAs, and the C-reactive proteins. All these tests are done in case of the SLE. This is acromegaly, this is a we have discussed this case. Okay, this is hypothyroidism. There is baldness, there is loss of hairs, and there is older type looking of the skin, and here we are having the enlarged neck. So this is hypothyroidism. Okay, this is diabetic foot, as there are ulcers present over the toes. So these are the diabetic foot. 1 second. Okay, and this is Parkinson. Okay, and this is a picture of Bell's palsy. Here the one side of the face is affected, and these are the sides of Bell's palsy. That is one side of the face is affected. If only eye is affected, then it is ptosis. If the half side of the face is affected, then it is Bell's palsy or trigeminal neuralgia. This is cretinism. That is severe mental retardation, severe growth deficit, and paraplegia. That is lower limb paralysis. Rigidity, deaf, mutism, facial disturbances. The type and severity of brain, neural, and musculoskeletal arise from the. So this is cretinism. Okay. This is also cretinism, where there is severe mental retardation, severe growth deficit, and paraplegia. That is lower limb paralysis, rigidity, and facial disturbances. Now this is iodine deficiency disorder. Here we are having the goiter. This occurs in hypothyroidism, impaired mental and physical development, and this is xanthomata. Okay, xanthosoma, as we have discussed it. This is xanthosoma, and this is the clinical examination of thyroid. This is congenital hypothyroidism, as you can see in the neck, and this is newborn baby. So this is congenital hypothyroidism. This is endemic goiter, that is a very enlarged neck. This is goiter, and okay, this is eczema, and this is microglossia. The pictures are not so clear. Okay, so this is hypothyroidism, and this is the before and after picture. This is eczema and keratonemia. This is solid edema. This is xanthomata. Okay, these are the xanthomatas present. These are kind of ulcers. This is spider nevi, and this is juvenile rheumatoid arthritis. Okay, so these were all the pictures. We have discussed scenarios first, and then we have discussed the specific pictures. So this is exophthalmos, koilonychia, ptosis, acanthosis nigricans, SLE, acromegaly, hypothyroidism, and diabetic foot, Parkinson, Bell's palsy, cretinism. This is iodine deficiency disorder. This is xanthosoma. This is examination of thyroid. This is congenital hypothyroidism. This is endemic goiter. This is eczema. This is microglossia, and this is recovery after L-thyroxine. This is the eczema with carotenemia. This is solid edema. This is xanthomata. This is spider nevi, and this is juvenile rheumatoid arthritis. So this was all about the important scenarios and the pictures that are commonly asked in the talks. Thanks for watching.